Okay, good morning. I'm pleased to report that virus activity in Iowa continues to decline. In fact, our statewide average positivity rate is now in single digits, 8.6% over the last 14 days and 6.4% over the last 7. Yesterday, there were 292 Iowans hospitalized due to COVID-19. That is an 80% decrease since our all-time high in mid-November, and it's the first time since September that hospitalizations have dropped below 300. Additionally, 49 new patients were admitted in the last 24 hours, and that's down from a high of 243 in mid-November. 67 patients were in the ICUs, and that's down 90% from record levels during that same time frame. Our long-term care facility outbreaks have dropped to 33 from an all-time high of 166 long-term care outbreaks, and we continue to see that number decline, and we continue to see outbreaks among residents and staff decline as well. Back in November, in the midst of the surge, the projected number of days that total cases would double was just 33 days. Today, it's at 94 days to double our cases. And this is one of those metrics that's best when it's higher, and 94 is as high as it's ever been, going all the way back to the start of the pandemic. So we're continuing our recovery in a strong position, and while the pandemic is not over, Iowans have proven again that we can manage it while living our lives responsibly and normally. Over the weekend, the state's updated emergency disaster proclamation went into effect, lifting statewide requirements to ensure social distancing in certain circumstances, limit gatherings, face mask requirements, sports activities, some of those were paused, and hours of operation. And I want to remind Iowans that these requirements were put in place back on the evening of November 16th, when I addressed the state about how serious the situation was, and I asked for Iowans to help. At that time, COVID-19 cases were surging, and our hospitals were being pushed to the brink, just as I described a few moments ago. So I announced additional mitigation measures targeted toward activities and environments that would help turn the situation around in hopefully a relatively short time frame. Iowans doubled down, and it made all the difference. Over time, COVID cases dropped, hospitalizations stabilized, and we began to relax some of the extra mitigation measures. Because, as I said from the beginning, they were never intended to be in place permanently. My approach has been consistent from the very beginning of COVID-19. When virus activity increases, we'll dial mitigation efforts up in response, and when it comes back down, we'll adjust accordingly. As I've said for months, and I'll continue to say, we must learn to live with COVID-19 and effectively manage it within the course of our everyday lives. For nearly a year, you've heard countless times the steps that we can take to protect ourselves and others from the virus. We know what we need to do, and it doesn't require a government mandate to do it. Prior to November, Iowa didn't have a mask requirement, but most Iowans wore masks, and I'm confident that they will continue to do so. I also trust that business owners will continue to make decisions about how they operate that are in the best interest of their customers and their employees, just as they've been doing for months. For example, many restaurants have invested in creative ways to ensure the safety of their patrons and employees, and I don't expect that to change. Today, I'm pleased to have George Migliero join me, and George is the owner of G. Miggs 5th Street Pub in the Valley Junction area of West Des Moines. And like many others, he's adjusted his business model over the course of last year and doesn't plan to change it anytime soon. So George, thanks for being here today, and we'll throw it over to you.
Thank you so much, Governor, for having me on here today. As a committee member of the Iowa Restaurant Association, I first off want to just say the Iowa Restaurant Association wants to thank everyone who has supported us through these very difficult times. It's been a stressful and uncertain journey, for sure. However, we know that no matter how hard these times are, we will prevail and we will gather again with good friends, good food, and celebration of all that life has to give us. The changes that we've made at G. Miggs have been very dramatic. As soon as we heard about the COVID-19 coming into effect, we ended up taking all the different procedures that we had, we changed them. We ended up revamping our kitchen procedures for how we are going to be doing the carryout, because carryout took over 40% of our business. Additional mitigation, what we did is we took all the seats away from the bar. We took away seats that were at other tables to give all the spacing for all the guidelines that we were following. Additional mitigation, we ended up putting inside all the bathrooms, touchless water faucets, hand soap, paper towel, all those types of things. We added sanitizer liquid, sanitizer wipes that are available for all the patrons that come in. For the most part, we've had a positive response from all of our customers and our employees. They're grateful that we are trying to do the best that we can to keep them safe all the time. We've been in business for over 8 years and fortunate enough to have a loyal following. But for the most part, everybody is in this together. We as a family at GMIGS, we always want to make sure that the people that are coming into GMIGS always have a mask on. When they come in, when they sit down, they can take the mask off while they're eating and drinking. When they get up to go to the restrooms, we want them to put the mask back on. This is a safety feature that we have just to keep everyone at GMIGS safe. Our primary concern is for our customers and our staff. It's been difficult for everybody. But we will continue to keep going through all the different procedures that we have. It's important to all of us to keep safe. Our livelihoods are on the line here, and we just want to make sure that people don't think that because you've lifted some of these, that everybody it's a free-for-all. It is not. It is something that we will still follow all of the procedures that we have, knowing that we've been through this together, everyone. We hope for their support and know that things will get better. As long as we're vigilant in regards to safety, we always know that everything's going to get better for us. But that's pretty much where it's been. Our business model has changed. This is going to change a lot of people's lives, the way that you think, the way that you will interact with other people. We always want to create a safe environment. That is the biggest thing for our customers that come in here. We're a family-friendly place. We love the people that come in there and support us. But the thing is that everybody has to be vigilant. We have to keep going and keep doing positive things so that when this is all done, everybody is going to get back to some sort of normalcy in their lives, where they feel safer being out with other people. And that's the whole thing, because the Restaurant Association, with all the hospitality, everybody's been suffering through this whole thing. But we know that with the changes, things are going to get better. With the vaccines coming and everything, it's all positive. The numbers are going down, everything is getting better. And that's all we hope for, is knowing that the future is going to be better. We have to have a positive. There has to be that light at the end of the tunnel where everybody feels that there's something good to think about for the future. It isn't doom and gloom, and we're excited about it.
Oh, thank you so much. I really appreciate that. And I appreciate your positive attitude, and I appreciate your commitment to moving forward in a way that makes sense for your business, for your customers and your staff. And we see that with businesses that we talk to all across the state. You know, it's important. Your customers are important to you, and you're going to do everything you can, not only to take care of your customers, but your employees as well. And this is a joint effort. So thank you. Hey, and in case our viewers don't know it, it's worth mentioning that GMIGS won Best New Food at the Iowa State Fair in 2019 with your pot roast wrap, which is delicious, I will add. So since there wasn't a fair in 2020, I hope you'll be back to defend your title this year, and I can't wait to try what's next. So thank you.
Absolutely.
Thank you.
Thank you so much, Governor Reynolds.
Thank
Have
you.
a wonderful day.
So last week I shared that my team and the Iowa Department of Public Health were looking into lower than expected vaccine administration rates in some counties and in the state. And we did this to start to identify barriers that could be slowing down vaccination efforts and, look for ways that we could quickly resolve them. And today I'm really pleased to report that we're making some really good progress. So some counties where the vaccination rates were lagging, they had been forced to cancel clinics due to the severe weather that Iowa experienced over the last 2 weeks. So the good news is those clinics have been rescheduled this week and counties are catching up quickly. Other counties didn't transition to 1B until February 1st, so just some communication efforts there, but now they have, and so they have quickly ramped up and they've surpassed an 80% vaccination rate since making that shift to 1B on February 1st. However, there still are some counties that need additional assistance from the state to administer their on-hand vaccine inventory, and we're continuing to connect with them, and we're ensuring that plans are in place to help expedite that process. If counties don't have enough resources to administer the vaccine, we are working with them to provide contract nurses to help, and we're also looking at ways that the Iowa National Guard can support mass vaccination efforts across the state. If necessary, additional doses for some counties may be reallocated to others while they get caught up. And that's just an effort to make sure that we don't have vaccines that aren't going unused. So once they get caught up, then they'll go back to their normal allocation. As I've said, our goal, as well as everyone's goal, is to get as many Iowans as possible vaccinated as quickly and as safely as possible. As of yesterday, Iowa had administered nearly 269,000 first doses of vaccine, approximately 90% of all first doses received. More than 10% of all Iowans aged 16 to 18 and up who are eligible to be vaccinated have had at least one dose, their first dose. In the past 2 weeks since allowing for the expansion beyond 1A, Iowa has administered nearly 189,000 first and second doses of vaccine. And of that 189,000, more than 105,000 were administered in the last 7 days. And that's an average of nearly 15,000 doses per day, and it's increasing. And more than 20,000 doses were administered last Friday alone through large-scale vaccination clinics that were held in several communities across the state. So one of those clinics was hosted by the University of Iowa Hospitals and Clinics in partnership with the Johnson County Public Health. And let's take a look at that video that they put together with that large vaccination clinic.
Well, today's a very special and exciting day.
We're on our way to vaccinating over 1,000 Johnson County residents at HSSB today as part of the Phase 1B launch.
We've really engineered here at our site a way to not only get in efficiently, but also to do it safely and make sure we're following all of the social distancing, hand hygiene, appropriate masking, and we're taking care of individuals in our community, those that are over the age of 65.
All of our teams have been able to put this operation together in a really short turnaround and do it in such a way that it is efficient and that it's safe, and we can really get a lot of shots in arms quickly.
Well, I set my alarm, 2 alarms. Didn't want to miss it.
Oh, it just means the world. I'm so excited to have the vaccine.
It's just like the feeling of restriction is a little bit less.
I feel quite relieved that I got the first dose, and I am scheduled for a second dose in a month.
I'm very glad that so many smart people are working on this to overcome this really bad disease.
And the process here has just been seamless and very organized.
We feel like we will be protected after the second dose.
Because I think it would make it easier on everyone. If the community can buy into this.
Within UIC, just being one of the largest healthcare systems within the state and within Johnson County, it's been invaluable to have that expertise approach us to be able to provide the assistance that we needed and also to work together to set up a site like this.
we'll approach this moving forward with a humility that UI Healthcare is just part of the county vaccination effort, and it's important that all Johnson County residents that are eligible in Phase 1B have access to the vaccine. And we will be doing everything we can with our government partners, our community partners, to make sure that all eligible patients within Phase 1B get their vaccine.
Very honored to be here and be a part of this day. My hopes for the future are that we can have enough supply so we can get everybody vaccinated.
Well, I think of today as the first day of the rest of my life.
So I want to thank UIHC and the team at Johnson County Public Health for making this clinic possible and vaccinating 1,000 Iowans age 65 and up. It's so inspiring to see the level of teamwork and the hope and joy that it brings to the community. And as more vaccines become available, more opportunities like this will be possible in other areas of the state, and we're already seeing that happen. Now for a brief White House update. Yesterday, the White House held its weekly COVID update with governors across the country, and they announced yet another increase in vaccine allocations to states. So beginning this week, states will receive 5% more vaccine than last week for a total of 11 million doses distributed nationwide. Our allocation will increase to 49,900 total doses, which could arrive as soon as the end of the week. Also, this week, the federal retail pharmacy program kicks off with 21 national pharmacy partners and independent pharmacy networks nationwide, totaling 40,000 participating locations. In Iowa, that program will include more than 40 Hy-Vee pharmacy locations and 30 pharmacies that are part of the CPESN network, expanding access to vaccines in many Iowa communities. All participating pharmacies will be announced soon, and information about how to get an appointment will be provided by local public health departments and the pharmacies in their local communities. We'll also add these pharmacies to the vaccine provider information on coronavirus.iowa.gov. Last week, I told Iowans that we were committed to streamlining the vaccination process by providing easier access and extra assistance for those who need it. Last Thursday, the state issued an RFP from companies that could work with us to create a front door to the vaccination process for Iowans. This is a place where individuals can register to be vaccinated and then be referred to a provider when they are eligible and vaccine is available. Earlier this week, Microsoft was selected as our partner to develop and deploy a vaccine registration and appointment scheduling system. And we're now reviewing proposals for the addition of a call center to really complete the operations. We understand that Iowans are eager to have a centralized access point like this to make getting a vaccine as easy as possible, and that's exactly what we're working every day to achieve. We'll continue to keep you updated on that progress. Last week, I also shared that the Area Agency on Aging was another resource available to assist Iowans age 65 and older with understanding more about vaccination and the resources available to assist them. Now the program is up and running, and they're providing more details about how they can best help. For scheduling, they've asked that individuals first contact their healthcare provider or pharmacy to find out about availability of the vaccine and whether they can schedule an appointment. If they aren't successful, the AAAs will provide those names to their county public health department, who will work with the providers to schedule those individuals for a vaccination. For those who need assistance with transportation, the AAAs will be identifying support for individuals in need of this service. The AAAs also wants to inform older Iowans to be aware of scams that are related to vaccinations. So if you receive an unsolicited phone call about scheduling a vaccine appointment and are asked for your Medicare number, Social Security number, or credit card number, do not provide it. Instead, ask the caller to identify themselves and then call them back at the publicly listed number to ensure that they are who they say they are. So in closing, I again want to reassure Iowans that we're taking every possible step to ensure that as soon as our weekly vaccine allocation is received across the state, it's immediately being made available to eligible Iowans. This is our highest priority, and we'll do everything that we can to make the process more efficient so that we can continue to increase the rate of vaccine administration in every county. Of course, it goes without saying that supply will continue to be a challenge for some time. So again, I ask for your patience. I know it's frustrating. You've waited several months for the vaccine to become available, and now they're finally here and the wait continues. But I am confident that the supply will continue to increase. More vaccines will become available, and in time, every eligible Iowan will be vaccinated. In the meantime, I ask that you continue to do your part to protect yourself and others from the virus. And just as a reminder, it's still flu season, so if you haven't gotten a flu shot yet this year, there's still plenty of time to do so. It's another important step to keeping our communities healthy and our healthcare resources stable. So at this time, the rate of flu in Iowa is very low, so let's keep it that way. And with that, I will take your questions.
Governor, I remember covering President Trump and him saying that the vaccine might be available before the election, which would have been in late October or early November. Were you counting on the federal government to schedule vaccinations? Is that why the state didn't have a system, a centralized system for helping Iowans schedule?
Well, you know, it's been a process throughout all of this, and we've been reacting, responding, and preparing. So the Department of Public Health, my office, the Department of Health and Human Services has been working together not only to continue to test Iowans, but to make sure that we had adequate PPE and to make sure that we had a process in place to deliver it. So our part of the issue with our rollout, Kay, has to do with the number of long-term care facilities that we have in the state. That's just a fact. On a per capita basis, we're in the top 5, and every state will tell you this. I'm on a call with all governors weekly, and it is not a partisan issue. They have been very frustrated with the rollout of the long-term care partnerships and the time that it's taken for them to implement it, and the way that that's been displayed on the CDC website, and how it looks like states aren't adequately administering the vaccine. So that's been a problem. I think we're through that. We're really close to wrapping that up. I think in the next couple of weeks, by the 21st, I think Walgreens will be through with their second dose, and then they'll have one final clinic for individuals that didn't take advantage of the first dose, got their first dose with a second clinic that now has to follow up with their second dose. So we're starting to see that finally wrap up, and we were able to do a reallocation of the vaccines that they hadn't used. So that was an infusion of, I think, like 56,000 vaccines last week, something close to that amount, 64,000. So we're starting to wrap up. In the meantime, we've been working with local public health, we've been working with our hospitals, we've been working with our clinics, but that doesn't mean every day that we don't learn something new and there's not a way that we can be more efficient and effective in what we're doing. Several other states have also issued RFPs and are looking at companies that can help streamline the process and create that front door. So you'll see this happening in states all across the country. They're at about the same place we are, and we're going to continue to look for ways that we can streamline it, make it more efficient, where we can help counties that need it, where we can set up mass clinics so that we can, Suresh was talking about doing 1,000. They think that they can increase their capacity, and as we bring in the long-term care partners with Hy-Vee and the other local pharmacies, we're going to be able to continue to increase those numbers as well.
Governor, why didn't anybody foresee that there would be a need for a centralized registration system for appointments?
Well, I think those are some of the things that we've tried to take this infrastructure that we have and make that available. And some of the problem is really a lot of our systems are just so antiquated and they're siloed and they're not operating in the capacity that we need them to do. So we've spent a lot of time with the regions, just like, overnight. Remember when we started with the vaccine, we didn't know how many beds and ICU, how many vents and beds that we had available because we had a phenomenal system, but nothing communicated or talked. And so in a relatively short timeline, we were able to put together a system to identify how many total ventilators we had, how many ICU beds by region, and what was available and where the need was at, and adjust accordingly. That took a tremendous amount of cooperation and coordination by our hospitals and clinics, and I'm really proud of the effort that they were able to put in place. So we had that system in place to try to distribute the vaccines and get the clinics up and going, working with our local partners as we have more vaccines become available, as we have more providers be a part of the mix. We need to continue to look for ways that we can streamline it. And so that's what we're doing. And, with the RFP, they're indicating that in 2 weeks they can have that up and going. So the biggest problem of all of this has been the amount of vaccine that we receive. So step back, up a week ago, we were only receiving 19,500 vaccines. So I don't care what kind of system you had in place. That's just not enough vaccines to really do what we needed to do. And so as we see that ramp up, we're going to continue to enhance and make our systems more efficient, more effective, work with our partners. And every day we're seeing that get better and better. Just in a week, the amount of efficiencies that we've been able to put in place and the increase in the percentage of vaccines administered is good. It's not. We can be better. We're working on it. But when you consider weather and what we've had to deal with, we've gone from, I think, 47th to 37th. And so we're going to keep working on those numbers, and we're going to keep getting better at the process.
Can you talk about what changed from the time you last briefed Iowans last Thursday? Most of that news conference, while it started with virus and vaccination efforts and such, most of it was about another topic. And then late that next afternoon is when you announced you're getting rid of the restrictions that you had started earlier. Were there some metrics or something in there that changed that you didn't know Thursday to announce that so you could explain that to people?
No.
Or
I think
what's the process?
We just really were focused on vaccine at that point, and we were still watching the numbers and still making the final determination on what that looks like. But nobody was happy with where our numbers were at and where the administration was at, and we were trying to get to the bottom of that so that I could talk to Iowans about the doses that were coming in, how they were being distributed across the state, and what we were doing to help really increase getting vaccines in the arms of Iowans. So that's really what we were focused on. I wanted Iowans to know where we were at, what we were doing to make the system better so we could make it more efficient for them when we started to get more vaccines and move into the next step. But honestly, Dave, my position on dialing up and dialing down on our metrics have been consistent from the very beginning. And I think that's one of the things that Iowans appreciate about the steps that I've taken. Because what's happened in a lot of different areas is, it's a moving target. And I know that was one of the biggest frustrations I heard when I talked to parents in our schools that had kept their kids hadn't been in the classroom for almost 11 months. They were so frustrated because every time they were given a metric and they were almost there, they'd take that metric and they would change it. Not only were their kids disappointed. I mean, I can remember one mom telling me that, they were said that they were going to get back in school next week and the kid didn't even react because he didn't, because they'd been told that before and it never happened. So, it's been consistent. I've said we'll look at the metrics as we get to a point where it impacts, our healthcare resources and has an impact on our hospitals. We'll take a look at some of the positivity rates, long-term care facilities. If it looks like we're at a place where we need to dial things up, when the kids went back to school, to our colleges, we were able to identify where the numbers, who was being impacted and where, and we responded accordingly. As soon as those numbers went back down, I dialed back down. So I've been very consistent, I think, in the steps that we've taken to dial up, dial down, and work through COVID-19. And really, I can say that. I've put them in place, but it's Iowans who have responded and did what they needed to do. They're really the ones that have made it possible for us to really keep 80% of our economy open, to have our kids back in the classroom, to be able to play sports this summer, giving these kids a break that they so needed, and to be able to have our kids in the classroom since August.
I'll ask you a couple of quick questions.
Sure.
On the mask issue, I'm not sure any public health official would recommend that it's time to send a signal to relax the use of masks. And I know you're saying it's a personal responsibility, everyone should continue to do that. But why would you as the public leader, the leader of Iowa, give a signal that it might be time to relax that?
Yeah,
and if I might, I have one other question.
Yeah. So what I'm saying is that individuals can make that choice, and they've done so. Prior to November, we didn't have a mask mandate. And I don't know if it was you sitting in that chair at that time that said, even when I put a very restrictive mask requirement in, You know, he said it's not enough, it's not going to help, it's not going to do anything. I had other members of the media say, do you think that's why the numbers came down for that brief time that we had? So I'm not saying don't. I'm saying we've been at this a year. You heard George. I hear that across the board. Iowans know what to do. We've been telling them for a year what they need to do, and they're doing it. They're doing it. You know, California's been locked down since March. New York, their numbers are no different. But we've been able to help a little bit with COVID fatigue by being reasonable and measured, and by not trying to balance the lives and livelihoods of Iowans. But, you know, some of the things, we look at the data, we look at the metrics, but again, I want to just talk about something that nobody ever talks about when we're talking about what we should do in the metrics we're looking at. Guess what's on the rise? Mental illness is on the rise. Substance abuse is on the rise. Young people contemplating suicide is on the rise. Child pornography is on the rise. Food insecurity is on the rise. Children being left behind socially, emotionally, and falling behind academically, that is on the rise. Delayed care at the hospitals is on the rise. Child and spouse abuse is on the rise. Hospitalizations are down 80%. Positivity rate is down. Days to double has gone from 33 to 94. Long-term care outbreaks have gone from 166 to 39. We're vaccinating older Iowans. We're almost through our long-term care vaccinate and assisted living. Very vulnerable population. We're working to vaccinate individuals 65 and older, essential workers, and teachers. So it's a balance. I'm not saying go out there and be carefree and not be responsible. I'm saying I trust Iowans to do the right thing, and I know our businesses will do the right thing too. They're doing it every day. Our schools are doing the right thing, you know. So I don't think they need me to say mandate it. And even when I talked to Iowans in November, do you remember me saying there's not enough law enforcement in the country to make people do what we say to do? But if we are reasonable and balanced and ask them to help us work together to bring those numbers down so we can open back up, keep our kids in school, keep our businesses open, then we're going to get through it, and we did.
I just had one other quick question, if I might, and this one is on the distribution of the vaccine.
Yeah.
I understand that part of the metric that the federal government uses is they distribute more to states that have a more efficient ability to get shots in arms. And so I wonder if Iowa's, you know, previously, I know we're doing better, and I have seen the numbers improve, but have we been hurt by that?
No, because I talked to General Perna 2 times last week. I talked to the White House liaison that's leading the COVID response. We personally talked to him this week. Then he pulled General Perna back on. And basically, the allocation right now to the states that we have access to is based on population. He went through the formula. It's the same. He said, because I don't want states thinking I'm sitting around a table picking and choosing who's going to get what amount of vaccine and why. Right now, we're going to keep it consistent. Now, those metrics might apply to some of the long-term care pharmacy partnerships that are in place. I don't know, David, I'll have to check that and get back to you. So that may be a metric that they're working with them on as we see, you know, our 2 partners that are operating with us in the state. That might be a metric for them. I can verify that for you, but this was just this week or the end of last, I can't remember for sure, where we had that conversation, and he assured me again that it's based on, and we still have some questions about that, because when we look at some of the, I think it's the way, it still ties back to the long-term care, because we're drawing down 100% of what we have eligible. The state has been drawing down 100%, so we're still working on some of that, but it's based on population.
Governor, do you feel at this point that we're getting a fair allocation?
Well, we're going to keep working on it. I know Senators Grassley and Ernst also just sent a letter asking them to verify. They've told me directly each time. It looks like I think we're going to have a better idea once we complete the long-term care partnership, because all of those doses then will be going to the state. It'll be easier to track and to monitor. Because we don't have eyes into that. You know, we've sat down, I talked to the president of Walgreens yesterday twice, because my point was, if you're sitting on vaccine that you don't believe you're going to allocate, like we did last week, could you please return those to the states so we can allocate it into the general population. And that's how we were able to do 64,000, which helped immensely. That helped our numbers because they were just sitting there. They are going to allocate another 10,000 doses, Walgreens, this week by Friday. And then they're again reviewing and are going to give us the numbers so that everybody feels confident in what they're going to utilize and what we think could come back to the state.
Thanks, everyone.